The new century disease. There are many diseases that are increasing the rate of spreading among young and elderly population. Like obesity, hypertension, diabetes, heart disease, and the century disease that all young people are afraid of if they are having family history or gene defect related to this disease is the Alzheimer disease. So Alzheimer disease is the disease of this century that affects brain function, that it is irreversible, destruction of the brain that cause memory loss, confusion, dementia, loss of intellectual, cognitive thinking abilities, remembering, and behavior. So if you want to know more about the brain function and the structure of the human brain, please visit my blog page or YouTube channel that it is already in the comments in the YouTube. So Alzheimer disease causes damage to the brain cell that reduce the ability to do its function normally because of the abundance of plaques that secrete another type of protein that affect the brain cell and its function. So what is the history of discovering Alzheimer disease? Alzheimer disease discovered on 1906 by Dr. Alois Alzheimer when examining dead women with an unknown mental illness with the symptoms that memory loss, unusual behavior, and some language problem. The examination showed abnormal plaques and tangled fiber caused loss of concentration between connection between the brain cells when interrupting the neuron to transmit the message to different parts of the brain cell and can affect the body's reaction to its environment. Risk factors of Alzheimer's disease. The risk factors of Alzheimer's disease are age. That if the person aged from 65 and older. Also, family history of Alzheimer's disease that can highly significant in transmission the gene to family members. So many researchers identified the gene that can be risk genes or deterministic genes that can be inherited by family member to have the disease. The risk genes means that the person probably carried specific disease associated mutation or is affected by genetic disorder. The deterministic genes believe all human behavior and activity are completely controlled by genes, and the environment can influence the activities or activation of these genes, and those who carry risk genes can get the disease more than deterministic genes. So the signs and symptoms of Alzheimer's disease. The signs and symptoms of Alzheimer's disease according to the stage of the disease severity. So the main signs and symptoms, it will cause cognitive impairment, memory problem in solving issues, difficulty with words, dizziness, difficulty in solving some simple tasks, memory loss, apathy, confusion for time and place. So Alzheimer's disease stages, we have early stage mild, that the person can be independent and can do his normal daily activity, only that the person have some memory problem like forgetting and there is some concentration loss. In the middle stage, it is called moderate. It is the longest stage that can last longer. The person can have confusion, getting very angry easily and frustrated, and can act unexpectedly. At this stage, the symptoms more noticeable. In this stage, the person needs help and can be partially dependent. So in the last stage, that is a severe stage, The person loses the ability to respond according to the environment, can't remember anything, can't control movement, and difficulty communication. So the person in this stage, he will be totally dependent. Diagnostic test for Alzheimer's disease. There are many tests to identify Alzheimer's disease, and if early recognition, early finding solution, and cure or maintain the patient health status from deterioration. First, the doctor may do comprehensive medical assessment to identify the family history or the signs and symptoms of the patient, and the doctor may refer the patient to a special doctor for more clarification and diagnosis. So the blood test also be required with the urine test and to identify the abnormalities test or genetic problems or any genetic problems in the patient. Also MRI or CT scan also required to the patient to identify the brain status and if there is any damages for the patient. So all these tests can recognize and identify the disease, and if early recognition, early treatment, good progression and prognosis of the disease. So the treatment of Alzheimer's disease varies according to the stage of the disease. Mild to moderate disease drugs are prescribed to control the symptoms like cognitive, behavioral, memory, and thinking symptoms. Medication like cholinesterase inhibitor prevent the breakdown of acetylcholine. Also an immunotherapy targeting protein beta amyloid that helps reduce amyloid plaque. Studies reveal the effectiveness of using this type of medication in early stage mild cognitive impairment. The treatment of moderate to severe Alzheimer's disease is also medication prescribed to treat the symptoms like the ability to do daily activities like using bathroom, eating food, and face washing independently. These medications will help in movement of the patient. Home management for Alzheimer's disease. The management of Alzheimer's disease at home very important to maintain patient health and well-being. The caregivers can create daily routine to reinforce familiarities, but if there is any changes can make the patient confused. So any changes done, so it must be done gradually. The most important thing, the caregivers must ensure the patient's safety by wearing safe and comfortable shoes, covering the head, hard place that may harm the patient like the edges of the table. Make sure the floor is not wet and with the water that can harm the patient and cause him to fall down. Be away from kitchens because it can cause him harm and he can burn himself or using knives. So the caregivers, he must be aware of all these things. Also the caregivers can plan activities for the patients with Alzheimer's disease like cooking, walking, dancing, listening to music or Quran, playing simple games, going outside and visiting friends. These activities can help the patient feel good and make the day busy. This can improve the patient communication with others and strengthen the social well-being of the patient, family, and friends, that he is not alone and there is support. Nutrition also, it is playing an important role at this stage of life. Is very important that help the patient to be well hydrated. Sometimes patient can't remember when they eat or drink. Also the patient appetite will be reduced and they may refuse to eat food. So the caregivers must fix time of the meal and make healthy and colorful plate, and the patient must take the food that it is rich in the vitamins and minerals and easily to chew and swallow, because in this stage the patient have difficulty in chewing and swallowing. Thank you very much, and if you like my video, please put like and subscribe to have new videos about the health. Thank you very much.